Every 16 minutes, another American man dies from prostate cancer, and 1 in 9 American men will have prostate cancer during his lifetime. Additionally, prostate cancer is the leading cause of cancer death among American men. So joining us to talk about prostate cancer today is Dr. Matthew Boyer with the Radiation Oncology Department at GBMC. Hey, Dr. Boyer, thank you so much for joining us. And of course, this is Facebook Live, so we're asking all the viewers to submit questions that you may have. This is just free and easy and simple ways for all of our viewers to be able to talk to an expert. So first, let's just start easy, simple question. What is prostate cancer, Dr. Boyer, and how common is it?
Well, good afternoon. Thanks for having me and the chance to speak with you. As you know, September is Prostate Cancer Awareness Month. It's important to get sort of the message out, so to speak, about prostate cancer and the treatment for it. The prostate is part of the normal male anatomy. Every guy has one. And cancer really is just an overgrowth of the cells within the prostate. They have the ability to lose their adhesion to the cells next door and form that tumor that we typically think of in cancer.
So who should undergo screening for prostate cancer, and when should screening begin?
Well, the biggest risk factor for prostate cancer is just age. It's uncommon in men under 50. It's rare in men under 40. And so most society guidelines recommend starting screening around age 50 and going till about men are around 70 to 75 years old. One of the biggest things that they mention or try to emphasize is that it should be a shared decision between the patient and their physician about when screening should start, how long it should go on for, and the risk and benefits of it.
So then, Dr. Boyer, how frequently or how often should men be screened for prostate cancer?
So the screening test really is a PSA test. It is a blood test. And that typically should be done every 1 to 2 years. The American Cancer Society recommends for men with a PSA under of 2.5 to have it done every 2 years, whereas men over of 2.5 should be done once a year. And again, it should run from approximately age 50 to about age 70.
And then are there anything that maybe increase someone's risk of getting prostate cancer?
Yes. So African Americans are at a higher risk of prostate cancer. If you were to look at a group of men in their 70s, the rate of prostate cancer may be 1.6% in African American men versus 1% in Caucasian men, and even maybe a little bit less in Asian Americans. So African Americans are at a little bit higher risk. Most guidelines would recommend starting screening about age 45 for that population. Also, patients with a family history of prostate cancer, as well as other types of cancer, including breast and ovarian cancer in women in their family, might be recommended to start treatment at age 40 or 45.
And if you're just now joining us, Facebook Live right now with Dr. Matthew Boyer, the Radiation Oncology Department at GBMC, keeping the questions going, asking you, our viewers, to submit questions on Facebook. He's going to answer them live on air. Also, how is prostate cancer diagnosed, Dr. Boyer?
So the screening test that we use is a blood test. It is a PSA test. That PSA is a protein that's made by any prostate tissue. So normal prostate makes it, prostate cancer also makes it. And when we see that it's elevated or it's continually going up, the next step is typically to have a biopsy done of the prostate. That's usually done with a urologist. It can be done in their office or sometimes done in the operating room.
And so informative, so great to have you here live answering our questions. We have our first question from Facebook, and that is, what about symptoms for men over 40? What should they be looking for to possibly detect something that they may have prostate cancer?
So fortunately or unfortunately, there's not really many symptoms of prostate cancer. That's why we look to do screening programs like PSA testing to try to find it at an earlier stage. It is possible that with a more advanced cancer, you could see some changes in urination, although that's typically unlikely. And most men, as they get older, will have a little bit of change in urination, maybe getting up at night to urinate or going more often during the day. But typically, unless prostate cancer is spread to another part of the body, there's usually not symptoms of it.
And I think many of our viewers at least have family members or friends who have been diagnosed with cancer. I know sometimes you'll see it from generation to generation. Is there anything about prostate cancer that is hereditary? Maybe you have a family member, brother, father, grandfather that had prostate cancer. Are you more susceptible to maybe get prostate cancer yourself if you are a male?
Yes, as you mentioned at the beginning of the show, prostate cancer is very common. Probably about 1 in 8 to 1 in 9 guys will get diagnosed with prostate cancer in their lifetime. That works out to be just a little bit more than 10% of men. But there are cases where their cancer does run in the family. For prostate cancer, things to look at are other members of the family, certainly with prostate cancer, particularly if they were diagnosed at an earlier age, possibly under 60 or maybe even under 50. It also can sometimes go along with breast and ovarian cancer. So if there's a strong history of that in the family, that can be one other thing to look at. And there are a couple genes that have been identified that can be passed down from generation to generation that raise your risk of getting prostate cancer. Probably the most studied one is called BRCA2. So it was initially identified in breast cancer. That's where the BR and the CA come from. Mm-hmm. But men that have this gene that's mutated can have a risk of prostate cancer that's up around 50% over their lifetime.
Wow. And so thanks again, Dr. Boyer, for joining us Facebook Live. Keep submitting your questions on Facebook. He's going to answer them live. Easy, simple. We have him here for your convenience. Continuing on, so let's say someone has been diagnosed with prostate cancer. As an expert, what does their road to recovery look like in terms of treatment options? And then we hear about chemotherapy, radiation, that sometimes that can make you sick, and it's months of recovery time for patients who have other types of cancers. What does that mean for prostate cancer in terms of recovery?
Sure. So after a diagnosis has been made with that biopsy, it's important to generate, we call sort of a risk stratification for patients, and that really takes into account 3 different things. One is their PSA level in their blood. The second is the results of that biopsy and what the cancer cells look like under the microscope. And the third is the stage of the cancer in the prostate itself. Based on those, we tend to try to tailor treatment to different patients on their risk status. So for men with a low risk disease, there's a number of different options that they could undergo. And actually one option is not to have treatment right then and there. So we know prostate cancer is a slow growing condition. And in a study looking at men who did not have treatment up front versus men who had either radiation or surgery, there was really no difference in prostate cancer survival at 10 years. The risk of dying from prostate cancer was only about 1% after about 10 years, whether you had treatment up front or you didn't.
Wow.
But for men that do want treatment, certainly radiation is an option and surgery is an option. Typically, chemotherapy is reserved for men that have had prostate cancer that's spread to another part of the body.
And Dr. Boyer, you touched on this a little bit early on during the Facebook Live interview, but we now have a viewer that's wondering when he should get screened because his doctor is advising him to get screened once he hits 50, but he's doing research online seeing where 40 is the suggested year that men should start to get screened for prostate cancer. So with your expertise, what would you suggest in terms of age ranges for prostate cancer screening?
So a number of different societies have guidelines. The American Cancer Society has guidelines. The CDC has guidelines. Really, they recommend starting at age 50 unless there is a higher risk for this particular person. Those higher risks, again, could be if he's African American or has a strong family history of prostate cancer or other cancers in his family. Typically, then you would start at 45 or 40. Really, just the risk at that age for the general population is so small, it just doesn't make sense to start that early.
And once again, if you're just now joining us, Facebook Live with Dr. Matthew Boyer with the Radiation Oncology Department at GBMC, taking time out of his busy schedule to answer your questions live here on Facebook as we continue to answer viewers' questions. So, Dr. Boyer, of course, when you think of cancer, you go through, it's a tough journey, it's a battle. you are able to beat this awful disease, go through recovery. Are there ways to prevent prostate cancer from returning? Because once we fight cancer, we want to do everything that we can so that we make sure that we protect ourselves as to not have to go through this fight once more.
Unfortunately, there's not been a great preventative measure found. There have been studies done with a couple different drugs. Finasteride is one of them, where it did show a little bit of a decrease in prostate cancer overall, but actually showed a little bit higher risk of getting a more aggressive form of prostate cancer. Now, there's also been studies looking at dietary factors, vitamins, minerals, about preventative treatment for prostate cancer, either once you've had it or before you've had it, and really none have shown a benefit. So when someone is diagnosed with prostate cancer, we tend to give curative treatment at that point. So we tend to give the tailored treatment that we expect to be definitive for that patient and not have to worry about preventative measures in the future.
And right now, during this pandemic with coronavirus, COVID-19, everything is honestly a little bit scarier than it has been in the past, especially when you're talking about a hospital where people with compromised immune systems are staying. We don't want to get COVID if we're already undergoing certain treatments for cancers. What, in your expertise, is there added risk for someone that's maybe diagnosed with prostate cancer right now as we're going through the COVID-19 regulations? How are you guys at GBMC taking extra precautions to make sure that your patients are staying safe?
Well, for a lot of patients, what we call active surveillance is an option. So there is that option to delay treatment. And typically patients will delay treatment for a couple years before they actually decide to have radiation or surgery at that point. So that is certainly an option if patients are concerned about exposure to COVID, or they have other medical conditions where they don't want to necessarily come into the hospital for treatment. The other way that sometimes prostate cancer is treated is with what's called androgen deprivation therapy. Hormone therapy is another way to describe it. But it is a shot that you get once, and it turns off the male hormone testosterone, which can be the driving fuel for prostate cancer. And typically patients can have that shot, and it is an effective treatment for their prostate cancer. They're receiving treatment for their prostate cancer as soon as they get that shot. And that can then maybe postpone the time when they would actually come in and have radiation done.
And once again, joined with Dr. Matthew Boyer answering our questions. Thank you for continuing to submit your questions on Facebook. You've touched on this some, but we're having more questions from viewers about certain factors that may increase someone's chance of developing prostate cancer.
Sure. So there are differences throughout the world. Prostate cancer is more common in the US than other parts of, let's say, Asia. We think that some of that may be due to our diet here that we have. We generally higher in red meats and animal fats compared to other parts of the world. There may be differences in genetics in our part of the world compared to other places. Unfortunately, those risks are generally small. Certainly, we can't pin down the cause of prostate cancer to one thing like we can sometimes with, let's say, smoking and lung cancer. And they really are sort of a factor of our society more than anything else. So the best way I think that we can sort of combat this is to do regular screening to try and catch this cancer at an early stage when we have effective treatments for it.
And once again, Dr. Boyer, going back over some of these repetitive questions, but who would you feel is the most likely to contract prostate cancer? I know you talked about African Americans being more likely, and then age ranges. Who is maybe more at risk for prostate cancer?
Well, really anybody with a prostate, so any guy is at risk for cancer. The average age of diagnosis is around 66 or so. There are some things that have been linked to higher risk, but nothing is definitive, as it would be, again, with smoking and lung cancer. And that's why really screening is important to try and find men at an early stage and offer them treatment that can be curative for them.
And then, Dr. Boyer, does everyone with prostate cancer need to be treated at diagnosis?
So no, so prostate cancer is very slow growing, and there's a range of cancer. So there's on the biopsy results, you can see what looks like essentially normal prostate tissue versus a cancer that looks very advanced, much unlike normal prostate. And for those men with a earlier grade of cancer, earlier stage, certainly they can think about doing active surveillance, which just entails getting repeat PSA tests, at some point having a repeat biopsy, and then having treatment sometime in the future. I think this is an excellent way, particularly for men that are a little bit older or have other medical problems, to limit the risks or side effects that go along with treatment.
And I know frequently women, we like to talk about things that are going on with our bodies, but men are more reserved. So what would you do to maybe encourage men to maybe talk about certain things that they're going through that could potentially lead to maybe some sort of illness, cancer, even prostate cancer specifically? How would you encourage men to maybe not be intimidated or not be, too proud to talk about some of the things going on with them medically? Because this is, of course, about being preventative and taking treatment early on to maybe save your life.
Yeah. So it's always helpful when the wife, mother, sister comes along with the guy to our consult. We certainly get a lot more information that way. But the most important thing up front really is to get the screening done. And so typically what that means is getting, again, wife, daughter, sister, whomever, to push the guys to come into their primary care doctor to have a conversation with them about screening, to actually have the blood test done. That's probably what's most important, because most men won't have any symptoms of prostate cancer when it does develop. And just getting the PSA test is the most helpful thing.
And then, of course, still Facebook Live, having viewers submit questions, more questions about COVID-19. I know that that's very scary. Cancer is very scary. What are you guys doing at GBMC to ensure that all your patients, whether they're going through cancer treatments or, right now is not a time to press pause on your health and stay at home. You still need to be going to the doctor with your checkups to make sure that you are still staying safe and have the ability to prevent certain medical conditions. What are you guys doing at GBMC to ensure that not only your patients, but staff as well are staying safe during this pandemic?
Well, for patients that are going to have surgery, typically they're having a COVID test done prior to when they come in for their surgery, for their operation. There's also differences in how the OR, or the operating room, is staffed and prepped for patients to limit any exposure to the staff that's there. In the radiation oncology department, we are limiting exposure from patient to patient in terms of when they come in to get treated, where they get changed, for when they have their actual treatment done. We have a plan in place. Fortunately, haven't had to use it yet, but a plan in place if somebody is positive while they're on treatment, to limit their exposure to other members of the staff and to other patients by treating them at the end of the day, and be able to do a kind of a thorough disinfecting after they come in for their care.
Awesome. And we just have a couple more minutes left on this Facebook Live with Dr. Matthew Boyer. So get your questions in quickly. We have one more question from a viewer. How are patients followed after treatment to make sure that their cancer has not returned?
So the most common way that we do that is just, again, with the PSA test. So typically after surgery, because all of the prostate is removed at that point, including the prostate cancer, your PSA level should go to 0. There's no tissue in the body left to make it. And so we can be very kind of precise in detecting a rise in that PSA, and we typically presume that that's coming from prostate cancer recurrence. After radiation, it's similar. That PSA number doesn't go exactly to 0 because there's some normal prostate tissue that's left over that's still functioning, but it gets very low. It gets down to usually around 0.1, if not a little bit less. And if the PSA again starts to increase over time, it's something where we would raise a red flag for us that the prostate cancer is coming back, and would push us to do more testing to see exactly if that has happened.
And then last question that we have before we let you go, as an expert in this field, what advice would you give to someone who thinks they may have prostate cancer? What are signs or symptoms that they could look for in terms of before they go in for maybe knowing that they need a screen for prostate cancer?
Well, the screening with a PSA test, and this is really true of any screening for any cancer, it's generally looking in patients who don't have any symptoms, who are asymptomatic at that point. So it really is a recommendation across the board. All men should be having prostate cancer screening with a PSA test. And then from there, if there is a diagnosis of prostate cancer made, I think one important thing to remember is that it's a very much a curable condition. The chance of actually dying from prostate cancer is very, very small. And there are multiple opportunities for treatment. And so when it comes time to kind of make a decision for treatment, I think it's important to meet with the urologist. It's also important to meet with a radiation oncologist. Those are the two main modalities by which we treat prostate cancer, to come up with a treatment plan that makes sense for each patient.
Awesome. Well, thank you so much for your time, Dr. Boyer. You may have saved some lives today answering all these questions. And really, the goal is go get screened, make sure that you can prevent before it becomes a bigger issue. And if you or someone that you know is concerned about prostate cancer, please speak to your doctor about the next steps that you can take to find out if screening is right for you. Thank you so much again for your time, Dr. Boyer.
Thank you. Very much appreciate it.